Um, so welcome everybody to this JRF website, webinar even. Thank you all for coming. I'm Peter Matichik, I'm the Chief Analyst at the Joseph Rowntree Foundation, and I just wanted to outline some housekeeping before we kick off with some great presentations from the University of Loughborough and other speakers. So in terms of some housekeeping, attendees' mics and cameras will remain off for all attendees, and due to the number of people in attendance, the session chat has been disabled to help streamline the session. But the Q&A function is open and available to submit questions to the speakers. Questions can be submitted throughout the session. As there are a large number of attendees on the call, we might not be able to answer all the questions, but we'll try to get through as many as possible and group questions when needed. There's also a number of JRF staff who will also type responses to some of the questions submitted when we can. The webinar will be recorded and available for all attendees to return to, and we will email all attendees when the recording is available on our YouTube channel. If you do experience any technical issues during the session, please reach out via our Q&A function or email events@jrf.org.uk, and we'll try and sort anything out. Hopefully that all makes sense and you can hear me okay. So without further ado, I'll hand over to Matt Padley and Juliet Stone from the University of Loughborough to do their presentation. So in terms of their biographies, so Professor Matt Padley is co-director of CRISP, where he leads on data analysis and the application and development of MIS in London, the UK and globally. Matt has pioneered and leads research on retirement living standards, and is one of the mainstays of the minimum income standards. We work really closely with Matt. And Dr. Juliet Stone is a research fellow at CRSP, where she focuses on quantitative analysis of income adequacy and leads on work on local child poverty indicators and poverty at the end of life. I think I'd also like to thank Abby Davis as well, who's another co-director of the Centre for Research in Social Policy with Matt, who leads the primary research for MIS and training for international teams in the MIS methodology, who can't be here today. And we're thinking of Abby. But handing over to Matt and Juliet to talk through some of the key results. Go for it, Matt and Juliet.
Hello, everyone, and thanks, Peter, for the introduction. And just to reiterate what Peter said, this part of what we're talking about today should very much be being done by Abby, my fellow co-director at CRISP. Unfortunately, due to family circumstances, she can't be here today, and she would have done a far better job of talking through at least the bit I'm going to talk about today, the qualitative findings of our latest update of the minimum income standard. Juliet is with me. She will appear magically halfway through to talk about the numbers, and I'm going to start by talking a little bit about what MIS is. I'm sure many of you are kind of aware of that, but it's good to kind of have that in mind when we're thinking about some of the key qualitative findings that have come out this year. It's also very important to kind of reiterate that this is very much a team effort. This is very much myself and Juliet representing pretty much all of the centre who've been involved over the past kind of year and a half in updating the minimum income standards to 2024. And thanks also to Adele and Peter at JRF for their continued support and questioning in a good way, and we couldn't do that without them, and we very much value that collaboration. There are lots and lots of moving parts in MIS. There are thousands of items to be costed. There are many focus groups that take place. There are hours of discussion, and it's not a surprise that we end up where we are every year, but it's an awful lot of work that goes into it, and I just wanted to kind of acknowledge that. There's a time for questions at the end after the responses, but also worth noting that the report covers everything that I'm going to talk about, and indeed Juliet, in far more detail. This morning is very much about some selected highlights. The next slide, please. We've always wanted to say that. So as I said, I think many of you will be aware of what the minimum income standard is, so I'm not going to labour this point, but some key kind of principles and ideas that kind of underpin what it is that we do. So in essence, what the minimum income standard does is address this question: how much is enough? What is it that everyone should be able to have as a minimum? What sorts of things should everyone in society, contemporary society, be able to do? To answer that question, what we do is get lots of groups of members of the public together from similar sorts of households to talk through and deliberate and discuss and reach agreement about what those minimum needs are. So the minimum income standard is very much kind of rooted in public consensus, and that consensus is informed by the everyday experiences of the participants in groups. And they're using their own experiences to inform those discussions on minimum needs. What we end up with, as I'm sure many of you are aware, are the income, well, firstly, minimum budgets. So what different sorts of households, different household combinations, compositions need in order to reach that minimum level, and then the income that they need to kind of pay for that minimum budget. So that's what MIS does, but there's an awful lot behind that. As I said, hours and hours of discussions and thousands of items in detailed budget lists that are available on the CRISP website. What MIS does and has done since 2008, since it was first published, is kind of track public conceptions of minimum living standards, track changes in these and any changes in social norms, as well as tracking the impact of any kind of structural changes within the UK, but also changes to services. And I'll pick up again on this point in a couple of minutes. The point of, or the value of doing this in tracking kind of minimum views of, or views of what minimum living standards are over time, is that we can pick up on the impact of those changing expectations. So post-financial crash in 2008, what was the impact of that, and how long did that take to kind of trickle through into these kind of shared understandings and conceptions of what it is that everyone needs? After a decade and a half of welfare reform and cuts in public spending, what are the consequences of that for a minimum income standard? MIS is used in lots of different ways. It's worth just flagging this up, and we're always very happy to have conversations with organisations who are thinking about using MIS or wondering how they can use MIS in their work. And still, after 16 years of doing this, we get new uses and new users every year. It's used by lots of charities in their kind of grants making processes. It underpins the real living wage. It's been informing thinking in Scotland about the minimum income guarantee. And recently we've adapted the method to look at minimum digital needs. Next slide, please. What have we done in 2024? We started from scratch with all households. We haven't done that since 2008. And what that means is that we've gone to groups of individuals from different sorts of households with a blank page and asked them what it is that they as a group agree that people need in order to have that minimum standard of living. And I'll show you the definition of that in a moment. It's important to note that the research was done between May 23 and March 2024. That was a challenging period for many, right through the cost of living crisis, prices increasing rapidly at a time when lots and lots of households were struggling. Food and fuel prices in particular remained high over much of that period. So in that context, we undertook 38 focus groups covering households with children and working age households without children, as well as pension age households. Hours of detailed discussions around what is needed as a minimum. Groups take this task very seriously. We ask them to think about someone who is like them, not what they need. But the deliberations and discussions are detailed and lengthy. And as I said, participants engage in this task critically and seriously. And we'd like to thank everyone who was involved in those discussions and was so engaged in that. We couldn't do what we do without them. Next slide, please. Oh, so all of those discussions are framed by this definition, which was put together back in 2006 when we first started the research, and this provides the context and the reference point for everything that we do. So a minimum standard of living is about more than just food, clothes and shelter. So it's not just about survival. It's also about being able to take part in the world around you and about having opportunities and choices in order to that are needed to participate in the world around you. Not endless opportunities and not endless choices. And groups often distinguish between what they see and agree is the need to have and what is the nice to have. But we literally stick this on the wall during all of those groups. So it is the reference point for all of the hundreds of decisions that groups make about the sorts of things that households need. Next slide, please. There is an awful lot in the MIS budgets, and I'm not going to go through everything today because that we'd be here all day, and we've all got other things that we need to be doing. What I'm going to do is provide a whistle-stop tour, but I wanted to give a kind of overview of the sorts of things that are included in those minimum budgets. As I said, the detailed lists of stuff, goods and services are available on our website. And when I'm not talking, I can pop a link in the chat or the Q&A, sorry, later on. But we have conversations about food. It's worth highlighting that we've kind of changed the way slightly in which we approach conversations around food, or certainly the composition of food baskets. We did this change in 2022 for households without children, so working age and pensioners, and have done it for households with children this year to reflect the changes in average weight and height of the population of the UK. I'm not going to say anything more about that, but it's changed quite significantly since 2008. Clothing, hours of conversations about clothing. Just picking up on a couple of things. School uniform figures quite prominently in conversations with parents about the clothing needs, those minimum clothing needs. What we've seen over time is a kind of growth in branded uniform for secondary and primary school. But what came out quite strongly this year was a kind of a limit to the support that's available for uniform costs in parts of the UK. I know in Wales and in Scotland, there is more support for some households with those sorts of costs, but that puts pressures on household incomes and also increases what people need as a minimum. Housing and related costs. I'm going to talk about housing in a minute. We talk about household goods and services, furniture, appliances, cookware, kitchenware. One thing to highlight this year was the introduction of a small air fryer for working age households without children and pensioners. Groups were kind of clear that this was an energy efficient way of cooking for one particularly, but households with children said it was inefficient, not large enough to kind of enable them or households with children to kind of cook the meals they needed to cook. In terms of services, mobile phones, broadband, delivery costs, childcare, babysitting. Pensioners are the only households that have stuck with a landline. This has disappeared for all other households. It's still very much seen by pensioners as a kind of important safety net for them if mobiles stop working. As you can see, there is lots and lots of stuff in the baskets in those budgets. And as I said, do go and explore them at your leisure. Next slide, please. What I wanted to do in these next two slides is focus on something that has picked up by MIS over time. And that is kind of consistency in what groups include as those minimum needs, or what the agreements that's reached about that, and change over time as well. So over time, for a long time, there's been no change in the ways in which groups think about the sorts of accommodation that would meet that minimum housing need for households. Pension age households and households with children, groups said that as a minimum, social housing kind of meets that housing need. For working age adults without children, they'd be very unlikely to access social housing, and therefore private rents are included in the kind of calculation of income requirements. However, what that masks, or what that kind of hides, is lots of conversation about the difficulties with accessing social housing, particularly for households with children in certain areas, but also a growing number of retired people who are in rented accommodation and unable to access social housing, and some changes in expectations about the sorts of housing that people expect later in life, and also what constitutes a minimum. And often what the minimum income standard research does is pick up on these sorts of changes before they have an impact on what's included as a minimum. So we get a kind of a hint of what's coming down the track. So when we return to groups in 2026 to kind of review all of these baskets and all of these budgets, I have no doubt that there will be more conversations about the accessibility of social housing and the availability of it in different areas, and the problems and challenges that presents. What also came out clearly is that in discussions about whether or not it should be social or private rented accommodation was the kind of the lack of quality in lots of private rented accommodation. Next slide, please. Where I'm taking up lots of Juliet's time. Arguably the biggest change this year, and the one that was kind of reported in the headline in the Observer on Sunday, is a change to the costs, or the budgets that are included by working age adults with and without children to cover some healthcare costs. So after lots of discussion and deliberation, and I'll let you read that, groups decided that for each working age adult, £200 a year should be included in that minimum budget. This was not about accessing private healthcare. £200 wouldn't get you very much private healthcare. As you can see from that quote, what it is about looking after yourself in order to be able to carry on with work, for instance. So if you've hurt your back, having £200 a year to access some physio, when the waiting lists on the NHS are very long, means that you're more likely to be able to get back to work sooner. But also, those sorts of things, so a back problem or kind of mental health challenges, prevent individuals doing the sorts of things that they need to do to participate in the world around them. So very much not about private healthcare, and very much a kind of a stopgap until they can access, further support on the NHS. But what this does point to is the kind of the way in which underfunded, stretched public services have consequences for costs, and consequently for the incomes that households need in order to reach that minimum standard. We can skip the next slide, I think, and go straight onto the numbers. Brilliant, thank you. Juliet and I are going to swap seats. Oh, before Juliet, yes, sorry, we're going to swap seats in a minute. Before we do that, and this has all been updated now, but following publication, we spotted an error in our calculations to do with how we treat auto-enrollment pension contributions in our earning calculations. So the online calculator, the minimum income calculator, is all correct. In correcting this decision, what this did was increase the deductions from earnings for all households, which meant that the amount that all households needed to earn to cover that minimum basket increased. It also had some impact on kind of the adequacy of the national living wage, as well, as Juliet will talk through. So all the figures today are now on the JRF website, the report version on there as well. So now we will change seats.
Thanks, Matt. Okay, so I thought I would start just by showing you an example of 4 different household types that we produce budgets for. So here we've got a single working age adult, couple pensioner household, a lone parent with 2 children, and a couple with 2 children. And this kind of just gives you an idea of the sort of ballpark of figures that we're talking about. So you can see that food and drink take up a fair proportion of the basket for all of those households, as well as housing costs. And for the households with children, childcare also comes out quite strongly as something that's taking up a lot of their income. I should say that you can find other combinations of households, both kind of set standard households in some annual budgets over time from our website, and also the online calculator that Matt mentioned. You can go into that and put in all different combinations of household types to get the budgets for those. But these are just some examples. Next slide, please. So you'll have seen in the previous slide that there was a row which said disposable, which represented disposable income. So that's what we're using here, and that is the total budget excluding rent, council tax and childcare costs. So that's kind of taking those out because they're what you might call non-negotiable costs. So this is the money that people have left over to spend. And you can see here we've got these four household types, just focusing on working age households now because we're talking about out of work benefits. And we can see how out of work benefits, to what extent they allow people to reach these MIS thresholds. Next slide, please. So the picture isn't very rosy for out of work benefits. For the single working age person, they only get 28% of that MIS budget, so only £85 a week disposable income, and not much better for the other household types either. And you can see that actually in terms of the cash amount, it's going from around £217 for the single working age and a shortfall of nearly £500 for the couple parent +2. And although the couple and the parent households are doing marginally better than the households without children, in terms of the sort of cash values that we're talking about, their shortfalls are much bigger. So they're clearly at risk of falling into debt just to pay for their everyday costs. And also an interesting thing to point out is that those out of work benefits for the households without children aren't even covering the cost of food and drink in the MIS basket. So they're falling far short of what they need for that adequate, socially acceptable standard of living. Next slide, please. So how does that look in relation to the national living wage? So here we've got the same MIS budgets, and we can look at what percentage of that budget people would get if they're working full-time on a national living wage. And in those households where there's 2 adults, they're both working full-time on the national living wage. So the picture's more mixed. It's slightly more positive than for out of work benefits. You can see here that they're all, much closer to that MIS threshold than they are with out of work benefits. And this sort of reflects, I guess, the focus of the previous government on work as the route out of poverty. So there has been more kind of effort to increase the sort of value of work in terms of people's wages. So this year, the national living wage increased by almost 10%, now at £11.44 an hour, whereas working age benefits have still lagging far behind inflation after the period of the benefit freeze between 2016 and 2020, and sort of the general period of austerity that was experienced since 2010. So we can see here that actually the couple working age do manage to meet that MIS benchmark. They're at 115% of MIS if both are working full time. But actually even, working full time, those other households aren't reaching that MIS benchmark. And we're also assuming here that people are able to access full-time, sort of decent, permanent work at the national living wage, which obviously isn't the case for a lot of people in the UK. Next slide, please. I'm just going to talk briefly about how this looks over time. So again, going back to out of work benefits, we can see here the percentage of that MIS requirement that people would have been able to get from out of work benefits from 2008, when the research was first published, up to this year. And you can see that actually the picture's got much worse since 2008. It still wasn't great in 2008. It was still less than half the MIS budget. But it's particularly since 2016, when the benefit freeze took hold, you can see that it's gone down dramatically from 42% in 2008 right down to 28% this year. Next slide, please. Yeah, and this is just the same thing for a couple with 2 children, and you can see very similar picture. That, you know, it was better pre-2016, but from that point onwards, it's gone down quite dramatically. Benefits haven't been operated in line with inflation over that period, and you can really see the impact of that on people's incomes. Next slide, please. Again, the picture for the national living wage is more mixed. We can see here that for the single working age adult, in 2020 they were at 88% of MIS, which you know, is getting further towards that benchmark. But again, since then, cost of living has gone up, and wages haven't necessarily kept pace with that increase in cost of living. So even for those in work, that adequacy has gone down. Next slide, please. And again, a similar picture for the couple with 2 children. In fact, in 2020, they were able to reach that MIS benchmark at 104% of MIS. But since then, particularly between 2022 and 24, that adequacy has gone down. It's partly to do with the increasing costs that people are facing, as Matt was talking about. The cost of living crisis in 2022 onwards has really increased the amount that people need to reach that standard. Next slide, please. And just to briefly talk about pensioners, who I haven't really talked about yet. So this chart is showing for a single pensioner the adequacy of the state pension relative to that MIS benchmark. And as you might expect, pensioners are doing better than working age households, much closer to that MIS benchmark across time. And this again reflects in part the fact that pensions are more generous than working age benefits. They've been protected by the triple lock over time, and have been operated more in line with inflation. But it's also reflecting the different costs that people face at these different stages of life. So, for example, in the MIS basket, people agreed that in urban UK, pensioners didn't need a car and would be fine using public transport. So assume that they are able to access their free bus pass. That means their transport costs go down dramatically compared to working age households. So this is a combination of that sort of more protected income and a reduction in costs. Next slide, please. Yeah, and this is again for couple pensioners. So similar story. But what you can also see is that for both these household types, although in 2008 they were reaching the MIS benchmark, even these households with that protected income by the triple lock on state pensions have seen a reduction in their income adequacy over time. So that cost of living is impacting households across the UK of all different types. And I will now pass back to Matt.
Musical chairs. Next slide, please. A couple more slides just to kind of sum up what we've said, and very much acknowledging that we've absolutely whizzed through what is a lengthy report, and you know, there's lots more in that we could have focused on, but I think we've kind of picked out key changes, but also the kind of key messages that come out. One of the things that has been stark over time in doing this research, and I've been involved since 2009, is the consistency in those core minimum needs, and the ways in which people talk about, for instance, sofas or saucepans, bedding, that sort of thing. A lot of those kind of core elements are the same as they were and described in the same sorts of ways as they were in 2008. However, there are these changes in expectations, these shifts in social norms, these shifts in society. Part of that is to do with changes in technology, but also, as I said earlier, we've been able to kind of look at the impacts of changes in service provision on what's needed for a minimum budget. That had an impact back in 2012 with the introduction of a car by groups for households with children, because bus services were seen to no longer kind of enable households with children to kind of do what they needed to do as a minimum. With some cities investing more in public transport, you know, there's always a possibility that could change in the future. So MIS kind of has those kind of core consistent elements, but picks up on those changes in society and in the provision of services. What's really clear is that out-of-work benefits are woefully inadequate and have become more so over time. I'm not going to, again, I'm not going to labour that point, but they don't, as Juliet, says, the fact that working age households without children on out-of-work benefits can't even cover the food and drink element of MIS, and that's not the alcohol drink bit, that's the food and non-alcoholic drinks. Just kind of points to the inadequacy of out-of-work support and support for some of the most vulnerable people in our society. It's also clear that work at the national living wage helps, but most households working full-time are still not able to meet the minimum income standard. Also worth noting that all of those figures are based on assumptions about the rents that people are paying and the housing that they can access. So if as a household without children, with children, you're not able to access social housing, then you are falling even further short of that MIS benchmark. So there's been progress and increases in the national living wage. Significant ones are to be welcomed, but it still doesn't enable most people to meet that MIS benchmark. Last slide. So next one, please. Few key points. Income matters, that's clear, both in terms of wages, but also in terms of support through the social security system, and often in the combination of those two things. And we need to think about what we do to make benefits more adequate or to kind of boost incomes, but costs also matter. And one thing that's clear over time and shown by the kind of diminishing value of the state pension relative to MIS is that if costs are increasing at a faster rate than support, then people fall further short of that minimum standard. So those increases in costs stretch available resources within households and kind of add pressures to household incomes. What's clear this year, more than ever, I think, is that public services also matter, and that there are consequences when public services are underfunded and are struggling. We've seen that very clearly through the introduction of this £200 for those sorts of healthcare services like physiotherapy or counselling, because of the long waiting lists of the NHS. So that has a consequence. That has consequences for both what people need in terms of minimum income, but it also increases costs. So what do we do? MIS didn't necessarily set out to provide answers to such a big question, but I think there are some, there are some signs that there are some good things coming. The Employment Rights Bill with protection for with regard to sick pay, for instance, and other protections for workers, and doing something to make precarity within employment, to do something about that. The Low Pay Commission being tasked with taking into account the cost of living. And I know there was something released this morning that I haven't had time to read yet about their remit, but how are they going to do that? What will that look like? Housing is clearly still a massive challenge, and the cost of housing in particular. We need reinvestment in public services. Childcare, we haven't talked about this a lot, but it came out in groups that the availability of free hours, for instance, and the cost of childcare, both of those things kind of place real pressures on households. And as Juliet noted, kind of transport brings with it a significant cost. What can we do to kind of make public services function better for everyone? Alongside, and that will address the cost side of it, alongside kind of boosting incomes. And I shall stop talking now. Thank you, everyone.
Thanks, Matt, and thanks, Juliet. So now we've got a couple of great discussants about these results. So I'm going to start off by introducing Devin Galani, who's a thought leader in the area of welfare reform, who's worked on universal credit since its inception and has written extensively on welfare policy, government spending and employment. Devin set up Policy in Practice, a social policy software and consulting business that makes the welfare system easier to understand and bridges the gap between the development of policy and its implementation. Its mission is to change people's lives by communicating policy properly so that people can make the decisions that are right for them. Devin, over to you, please.
Hi, Peter. Thanks so much. It's always funny hearing other people give that introduction. Great to see so many people taking an active interest in the new minimum income standard, and great presentation from the guys at Loughborough, which interestingly is where I'm from. And it's great to kind of see Loughborough on the map. I've got sort of a few points to make in response, and having kind of reviewed the latest figures. I think it's a really important paper, is I guess the first thing to say. So as we've kind of been dealing with austerity, I think we've been talking so much about making sure people have the basics and are not destitute and have a place to live. I mean, that's the kind of the space I work in most, is kind of helping local authorities help their most vulnerable residents. I think what the minimum income standard does is it focuses our attention on what it takes to live a good life. And I think there's a really important shift in the discussion there from just having the bare essentials to what it takes to live a good life. And I think reminding us of that is a really powerful purpose of the minimum income standard. I think on the numbers and the drivers itself, so I think it's a really important piece of work. I think on the numbers and the drivers itself, it seems fairly clear to me that I think the cost of living rising and support, particularly in the form of social security, not keeping up, is the story behind the MIS. I know that's most evident in the kind of the timeline of the MIS in the slides that Matt shared. I think in particular it's the cost. So most recently it's the cost of living going up and up. And it's very hard to lower, I think is what I would say. But at the same time, if you can lower it, so if you can kind of bring housing costs down by building more homes, we're some way off of that, but you have to kind of grasp the nettle with this stuff. If you can make childcare easier to access, that kind of brings cost of childcare down. There's some changes to the childcare offer just coming live now. But I think if you can bring the cost of childcare down and improve the level of public service that children get, there are like a range of necessary opportunities there. So it's a big win if you can bring that cost of living down. And I think it's really important to focus on cost of living, because I worry that the level of benefits, the money available to increase the level of benefits, isn't there right now. There still isn't that support for it. We're seeing how kind of the language of the new Labour government is still very much austerity and constraint. And I'm sure they'll look at that in a number of different ways, but I'll talk a bit about why, I think Liz Kendall's in a very difficult position at the moment, having kind of seen different governments try and tackle this. I think the first point to make, though, is for those of you listening and on the call, there are practical things you can do. This is kind of where Policy and Practice likes to focus, but helping people access unclaimed benefits and support. So our estimates are there's over £23 billion of unclaimed benefits from central government, local authorities, and other regulated sectors out there that, again, millions of people are missing out on, and many people are missing out on multiple claims. So I think there's three main points I just want to very quickly make there. The first is that you can use the information you hold on the people that you're dealing with every day. So even if you're just an individual listening to this, perhaps you know someone who could benefit from doing a benefit assessment. Others on their local authorities, housing associations, can use the data they hold on people to proactively let them know what they could be missing out on. I think there's a lot of opportunity out there to streamline assessments. So we're doing some work to pass data directly from people doing benefit assessments onto water companies, for example, obviously with the individual's consent, but then the water companies are just giving them a discount on their bill and not having to process the assessment because they know the assessment's been done by another trusted third party like a local authority. And that leaves the third biggest problem. So kind of awareness and complexity are kind of, we're doing some work to tackle those. I think the biggest one is stigma, people not feeling like this support is there for them. And that's probably where I think we need to change the conversation and build some support for social security. I mentioned a moment ago that we should also be thinking a bit about Liz Kendall's in a difficult position. And I think she's facing, when I was working on universal credit and saw that kind of go through government, I think, we talk about Secretaries of State of Work and Pensions as though they have the power in these areas, and they have the power to distribute what support they're given from the Treasury. Really, that's their job, is to make the trade-offs with, in the case of universal credit, when there were cuts being made to social security all over the place, how do we distribute those while keeping universal credit the show on the road? I think the position Liz Kendall's in is there will be some additional money for social security. What is the best way to deliver that across the social security system? Is it ending the two-child limit, which, you know, costs a couple of £1 billion? Is it kind of spreading that across the benefit cap, dealing with things like the under occupation charge, dealing with the fact that benefits haven't been uprated in line with pensions? Is it something like the essentials guarantee? There isn't the money available for all of those things, and there are so many holes in the social security system. The question is, will she see herself as her role as being plugging those holes, or will it be getting to a better minimum standard, which I think is what the Ms seems to be calling for? It's a very difficult position, and I think that'll be interesting to kind of see the Q&A on that. I think the point on the figures, so we've done some work recently with Joseph Rowntree Foundation on something called RAPID, so real-time analytics on poverty indicators. So we've compared the MIS using local authority benefits data to a range of other poverty indicators, so absolute poverty, relative poverty, and the Social Metrics Commission measure, which also takes costs into account. And what we see is that it's the comparison between the bare minimum and what it takes to live a good life, right? And the MIS is about 1/3 greater than the bare minimum in terms of costs. So I think that's for a single person. I don't have the numbers available for a couple right in front of me. Thanks to Kate for digging those out for me in the background while Matt was speaking earlier. And I'll share those in the chat for a moment. I'll also share the link to the RAPID poverty dashboard, because I think it's an interesting point of comparison to see how many people are falling below those lines relative to the minimum income standard. I think that the people on the webinar will be interested in that. And then I think that brings me to the final point that I wanted to make, which is the extent to which these numbers are going to ring true and where they're useful. So having kicked off my response by saying it's a really important measure to remind people what it takes to live a good life, I think, and you can see this if you read the report, you can sort of see the discussion, the debates that people are having as they're kind of informing them is, if you just post the numbers up, as I did with kind of a couple of members of my family, a couple of members of my team, the estimates for a single person is just over 27,000 or so, and then for a couple, it's about 66,000, I think. Do those ring true? I just ran them past my wife and others, and I think it's they sort of do as people think about them, but I think they still kind of, for a lot of people who are earning below that threshold, as I think we've just seen many people are, you're going to be struggling to accept that as being below that line. I think people still struggle with that, and I think it's almost the challenge with MIS is that the headlines are always the numbers, what people need to get a good life, whereas I think a lot of the value is in the discussion. So what kind of a life do we want, do members of the public want people to have? And I think it'd be great to see this time around in the follow-up to this webinar and to the coverage that MIS gets, that some of those discussions and the changing cost of those different things, and therefore what the government should do about those costs, is going to be could have a really big impact on kind of changing the nature of the discussion. So I focused a little bit more on costs and a little bit on benefits. I'm sure Tony will come in and talk a bit more about employment, access to employment, and wages. So I thought I'd kind of create that split, Tony, although feel free to comment on any of my areas too. The final point I just want to say is, we want to change the conversation around social security. It's going to need support. And you can see from, when we're talking about pensioners, cuts to the winter fuel payment, there's a whole range of, the government's being attacked on that front. I think we need to make the same sort of point on working age households as well. And I think that's going to be, it's a case that we should all be willing and able to make. The harder part is kind of recognizing the trade-offs that the Chancellor and the Secretary of State for Work and Pensions are going to face. And the final point is just to think about collectively what is it that we're calling for? Are we calling for fixing the holes, the biggest, deepest holes in the social security system, like the two-child limit? Or is it about getting a decent essentials guarantee in there for all? So people have enough money in their kind of standard allowance to pay for food and drink, as Matt was just pointing out that they don't currently. Or do we want to kind of really make the case and not recognise those trade-offs which I think is kind of where, you know, we tend to look at the policy and practice. We tend to look at the reality of those trade-offs. If you're a campaigning organisation, I probably wouldn't bother and just make the case for social security overall, because that's clearly where the pain is being felt, that and the rising cost of living. So thanks a lot. Brilliant work by the team at Loughborough, and yeah, I'll hand over to Peter and Tony.
Thanks, Evan. That was really great. Thank you for that really interesting presentation. So I'm going to hand over to Tony Wilson. So Tony's worked in employment policy and research for the last 20 years. As Institute Director at IES, Tony leads a team of 50 people delivering research, analysis and consultancy support on employment, skills, education and HR. He has particular expertise in labour market policy and analysis, the design, delivery and evaluation of employment and skills programmes, and supporting organisations to understand and apply evidence of what works in employment policy and service delivery. Over to you, Tony. Thanks.
Brilliant. Thanks, Peter. Thanks, Peter. Sorry, and thanks to colleagues at Loughborough as well for this excellent work, and thanks for inviting me to speak. Yeah, I'll just say a few words, really. I'll make three and a half points, I think, on this, and particularly focused, I suppose, around what the implications are for government, for a new government, and for all of us in sort of what we can do about it. And we'll build on, and I think probably echo some of the points others have made. I suppose the three things. So I suppose my 3.5 points are, firstly, around the inadequacies in our social security system. Secondly, around the extent to which employment is a route out of poverty, or a route to a minimum income, or a route to a good life, or however we want to frame it. And thirdly, around actually how we have more of an anti-poverty or a good work focus within our systems. My fourth point, I think, is specifically about kind of macroeconomic policy and inflation. Maybe I'll just touch on that. So firstly, look, you know, just to add to the choir of voices, and I think the discussion in the chat, I mean, what this highlights is what we already know, but it brings it home really clearly, you know, just how inadequate our social security system is, you know, for in terms of the levels of income it can offer to achieve something approaching a minimum income, you know, where people are out of work, and specifically for people of working age. The only bit I'd add, I think, is, I mean, there's sort of three things here. Some of this, I think, is quite straightforward to diagnose and potentially straightforward to fix, like the 2-child limit, the benefit cap, how we treat rents in the social and the private rented sector. They have really significant, not significant, they have costs attached, and there are trade-offs to that. We need to recognise that these are kind of political decisions, and there's arguments to be won on that, but that sort of feels all feasible and doable. There's also then things which I think where it's quite straightforward to diagnose what the problems are, but much harder to fix, like around treatment of health and disability, and where people are, you know, where they're unlikely or unable to work, you know, for a significant or extended period of time. And I think there's clearly appetite in government, and there's huge appetite outside of government for us to do this sort of far better and move away from a system which has failed over the last 20 or more years. I think the detailed design of that inevitably is sort of fiendishly difficult and complex, but it's, you know, I really do hope that'll be an important priority in the coming, you know, for the coming Parliament. But then the third point is, I think there are other things where I think we just need to have go back around some of the arguments and really sort of recognise and think through the trade-offs and some of the issues, and in particular around the difference between how our social security system supports sort of short-term income replacement and how we provide long-term financial security, particularly, you know, for vulnerable people and people who are significantly disadvantaged in the labour market, or have significant extra costs and needs. You know, we have a very sort of, we've always had in the UK, through thick and thin, a pretty sort of universal and sort of blanket approach on social security. There's many more gaps in the safety net now than there have ever been, but it's tended to be, you know, fairly consistent over the length of time you're out of work, and fairly consistent in its application around eligibility and who's entitled and who isn't, and so on. And I think actually, you know, there are sort of first order questions about the role of social insurance versus social security and how we can support people longer term. Don't have the answers on that, but I think they're important discussions we had. The second point, though, I think the main point I would make is around the second and third, the main ones I make, I think, around, you know, this does reiterate that getting a job is not a route out of poverty. You know, clearly getting a job helps. In the long run, having a good job with good prospects and a well-paid job, a secure job that's flexible, that's rewarding, where you've got good relationships and control, and you're engaged at work and everything else. Many of the things that many of us might take for granted in our own jobs, we'd want more of in our own jobs, but far, you know, not enough people have access to. All of these things are, you know, in the long run, lift us out of poverty and are protective of our health and well-being. But simply getting a job is not enough. And beneath just the averages that are presented in this data, there'll be huge variations across groups, and in particular, I just emphasize the point that disabled people face really significant wage penalties in work. They earn less than people who aren't disabled or don't have sort of work limiting impairments or health conditions. Many ethnic minority groups face quite significant differences in wages too. Disadvantaged older people, disadvantaged young people tend to be paid less, and many parents returning to work are trapped in sort of part-time employment, face a sort of part-time penalty, as do people with health conditions, where it's very hard to escape sort of low-paid work in part-time employment. So we have to, some of this is about tax and benefits, but actually I think the benefit system carries through into employment fairly well in the UK compared with many other systems. But much of it is around what happens in the workplace, workplace practice, what we expect of employers, but also how we work better with employers. And a lot of it is around our employment support system. And in particular, a lot of the work we've done over the last few years through our Commission on the Future of Employment Support, which will be reporting this month, actually. A lot of the work we've been doing has been trying to shine a light on, in particular, the kind of the any job, very compliance-based, punitive, suspicious, disempowering, and narrow employment support or service, such as it can be called, that often exists through Job Centre Plus and through sort of mainstream employment services, and then to try to set out what a better model would look like, which relies less on compliance and conditionality and sanctions, which is less kind of integrated in the delivery of a benefit system. It's less about the sort of that DWP formulation of fully integrated benefits and employment services, and more about actually how we can deliver services that are more compassionate, more empowering, that engage people better, and that recognises that kind of employment support is part of a system that happens in different places, locally and nationally, and that needs to be better kind of joined up and integrated and so on. This all sounds like sort of fine words, doesn't it? But we will have in our Commission report some pretty solid proposals on this. And that leads into kind of the third point, I think, which is, a really important kind of prior point, I think, is being really, really clear on our objectives around our employment system, and also clearly our social security system as well. And I suppose one reflection on the last 15 years is I don't really feel like under previous governments, back actually to the last Labour government, I don't feel like we've had a really clear articulation of what exactly we are actually trying to achieve in kind of economic and social policy terms through social security and through the employment system. Whether or not people, it needs a political and social decisions, whether or not people would agree with any particular government's perspective on this. The point is actually, I just don't think it's been articulated. And I think it's really important that we do have those objectives. Right now it's being framed around kind of growth missions, but getting beneath that, what is it that we want our employment system to achieve? What is it that we want our social security system to achieve? And on the employment system in particular, I think that needs to have a really, really strong focus on sort of tackling poverty and inequality and disadvantage in work, as much as it does around lifting people out of poverty and supporting people who are out of work, to prepare for to get access to and to succeed in work, where they're able, where they want to, where they can engage with support. And I think that anti-poverty focus does then have, anti below minimum income standard focus as well, I suppose, does then have really significant implications for how we sort of commission, design and deliver services, how we join up better locally. A couple of examples of that, firstly, is it can help to drive how we can better integrate across employment and health, which has been a real focus in recent years. There's been some and I think there's been some good work over the last 5 years around trying to better integrate employment support within health services and health settings, but also with care and responsibilities, with wider needs people may have in accessing work or being able to sort of thrive at work. But also actually how we join up much better around employment and skills. And in particular, some really good practice. We're terrible, I think, at the moment on properly integrating employment and skills support. And there's been good practices internationally which really look at how you can take an anti-poverty approach in supporting people in low pay to progress in work and identify those opportunities, those sectors and those occupational pathways that can support progression into better work, and do that in a way that targets support at people who are more disadvantaged in lower paid work. And I mentioned about workplace practice. I think that's really fundamental. The final point, I think, is that I think the government's announcements in the manifesto related to this, around the creation of new jobs and career service, and around local plans around work health and employment, I think around work health and skills, I think are really welcome. And I think there's a real opportunity to use those to drive sort of positive change within the system. I also think that the general kind of language around not stigmatizing people around benefits and around trying to move to a more empowering system as well is also welcome. And that's been a long time coming. And I think we should recognise that it is welcome, that we're actually talking in those terms now, I think, and a lot of the political dialogue is framed in that way. A final small point is I would just emphasise that the impact of inflation comes across really clearly here. It came across really clearly in that graph which showed how we're getting close to the MIS and then it dropped. So I do think there's also the point we have to step back and just say kind of macroeconomic framework and environment does really matter. This does also reiterate why it is really important to keep inflation low. And it also emphasises why it's really important to get back to strong economic growth, and that growth is shared fairly. Inflation is terrible, poison for people on low incomes in particular. And tackling inflation has to be an absolute priority. And I'm pleased that we're back to a more sort of stable inflationary environment. And we need to kind of stay that way. And I know that probably sounds a bit. I'm not an economist. It probably sounds a bit like a kind of something the Treasury Bank of England would say. But I do think it's important we do recognise that much of the damage in the last few years has been caused by really high inflation and kind of the inability to control and manage that. I'll shut up there. Thank you.
Thanks, Tony. That's great. So I'm going to just give a few kind of closing remarks on behalf of JRF, and then hopefully we're going to be able to answer some of your questions. So thanks everybody for sticking around. So yeah, I'm really proud of JRF's funding of the minimum income standard since the very beginning in 2006. It's one of our key anchor studies, each one of which we believe form key elements of UK social science infrastructure. So some of the uses I think you'll have heard from Matt, Juliet, Tony and Devon probably weren't dreamt of when this work kicked off all the way back then. It's used to set the real living wage, for instance, which meaning it contributes to the setting of wages for people in over 15,000 UK businesses. And that's an example of the kind of impact that's, that this piece of social science has had. I think since 2006, with the commitment from the University of Loughborough, we've built up an excellent understanding about how the level evolves over time, how it's affected by economic cycles, inflation, how different consumer durables move in and out of the basket as well. You've heard from Matt and Juliet about the painstaking processes involved in this assessment and the depth we ask focus groups to get into, and that allows us to get really into detail about what's driving the changes in the baskets. We can also see changes that coming down the track as times change. So in terms of availability of different services and stuff like that, there's normally kind of a warning in the previous year's report when something's just about to come in, because people can see sort of the writing on the wall. As Matt says, this year's MIS has been a particularly ambitious one because we've done all of the groups rebased at the same time. They sort of form a baseline for the next 3 issues of MIS. That's a really important one. And it's really important also, this inclusion of a small amount of £200 a year for private treatment as part of this year's MIS is really worrying. Because of this, the long NHS waiting lists was kind of a driver of this. And the issue that we've seen at JRF is that many families can't pay for private treatment because they don't already earn enough to reach the MIS. And so that means that basically they might move out of work or be unable to take part in society when their health gets worse. And the individual cost of this is huge, but it also means that there'll be issues in terms of like the government's commitment to growth as well. So it's terrible. And I took a part in a radio interview on Sunday, and some of the stories of people who phoned in after me about their health treatments were really heartbreaking. But more broadly, people can't contribute to society and make our economy stronger if they don't have a reliable public services. We need a strong foundation of decent public services and incomes to allow people to meet their needs. Only then will we see the economic growth that we need for everyone to thrive. The other element I wanted to emphasise is just how far from this decent living standard, not luxurious by any means, many families lie. We'll have to wait for this year's Households Below Minimum Income Standards report out later in the winter to get exact numbers. But what we see here is stark. So a couple with no children, where both adults receive out-of-work benefits, have just 27% of the minimum income standard, while workless single working age adults only have 28% of MIS. Again, a large gap, only like a quarter of the necessary amounts. And even if somebody's working full-time on the national living wage, only the couples with no children are able to reach MIS, whilst a single adult working full-time on the national living wage will only have 77% of MIS. So yeah, as well as reliable public services, everybody in society needs a firmer foundation of enough income to meet their needs. That means a national living wage that gives families enough, but also a very strong social security system that has an adequate social net for people who can't work because they might have a disability, or they might have caring responsibilities, or just they might be currently looking for work. And we'll be really looking for the new government to take progress and have some ambition here. So talking of ambition, I'm going to hand over very briefly to Rosario, JRF's Chief Insight Architect, who will briefly outline some of our work we are taking forward to build up the next generation of infrastructure, some of which I hope will be as successful as MIS over the next 2 decades. Rosario, over to you briefly.
Thanks, Peter. Before explaining what we mean by inside infrastructure, I just want to say that one of the things many things that I really like about MIS is the fact that it's rooted in the experience and direct contributions of people who are going through hardship and all the issues that we care about and we're trying to solve. And MIS is also the archetype, if you like, of the mindset underpinning the Inside Infrastructure Program, which is a program that JRF has launched a couple of years ago. And really, the main goal behind this is to build a better picture of social and economic inequalities in the UK. Why is that? Well, making sense of data on poverty and related issues is really hard. It's scattered all over the place. Data is not always inclusive or representative of all the different identities, characteristics, and experience across the country and what people are going through on a daily basis. But it's also really hard to turn that knowledge into action. So with that mentality, we committed to the creation and development of the Inside Infrastructure Program of Work, which is meant to become a trusted toolkit, if you like, powered by different tools and resources to help tackle injustice and inequality in the UK. So our main goal is really to democratize access to high quality data and evidence to inform decision making, but also to bridge the gap between the worlds of quantitative data and qualitative data, so the direct experience of the people that we exist to support. So we are trying to create a series of possible routes from problem to solution. Very much like MIS, this is the intention. We don't know what the future might look like, how this might evolve, but we are really confident that we're moving in the right direction because we spend a lot of time talking with the people in the sector and beyond the charity sector, but more importantly, with people with direct experience of poverty and issues that we are trying to solve. So what we have been deploying lots of different tools. Devin has mentioned Rapid, but we're also experimenting with new data sets. Like we've recently launched a collaboration with Smart Data Foundry using banking data to understand the income volatility. We also launched a new dashboard. Peter mentioned the anchor studies, MIS being one of those. The cost of living dashboard is also available. One of my colleagues will be sharing links in the website, in the chat, so you can have a look at the website. But really what we're trying to do is to enable that transition to a much more equitable and just future free from poverty and inequality, where all the different experiences, whatever you are in the country, whatever you're going through, is accounted for and inform the decision-making process that we are going to take to be able to enable that transition. I could probably spend hours talking about the inside infrastructure. My final point will be emphasizing once again that it's not just about the numbers. We are running actually 3 programs involving people with direct experience of poverty, a large piece on social media listening in collaboration with Demos. We are running our own program called Grounded Voices. So we are in direct conversations with people experiencing hardship across the UK. And this is informing the stuff that we put out there, things that we've said during the general elections, but also how we shape programs moving forward. And then last but not least, we are very lucky to work with a group called GPAG, which stands for Grassroots Poverty Action Group, which has been supporting JRF for quite a long time, including some of the flagship reports like UK poverty, destitution, and so forth. So to bridge that gap between the direct experience of poverty and the solutions that we or others, because we're doing this in open collaboration, might implement is very keen at the core of the Inside Infrastructure Program. Over to you, Peter.
Brilliant. Thanks, Rosario. So I just want to conclude by thanking the whole of the team at Loughborough, especially Matt, Abby, and Juliet, as well as Adele and Helena at JRF, who've all contributed to this excellent resource. And my final thanks are to all of those hundreds of people who took part in focus groups to build up such a rich picture of what people need for a decent living standard in the UK in 2024. I'm hoping that we can all work together to make sure many more people meet it in future, because I think what we've seen here is that at the moment there's an unacceptable gap to it for many people across the country. So with that, I'd like to invite everybody who's present to go on to camera, because now it's the turn of us to answer some of the questions that have come through on the chat. So can people come on camera? Excellent. So the first question, which I'm going to start with a methodological question, and then I'm going to actually come on to like a policy question, is how is disability treated in the minimum income standard, and sort of what's the implications of the extra costs of disability for people being able to meet the minimum income standard? So I'll hand over to Matt and Juliet to start with, but then Devon, Tony, be good just to hear your perspective on sort of some of the solutions for people who are who are disabled people. It'd be really great to hear. So Matt and Juliet, can you have a kind of stab at like the methodological side of it?
Absolutely.
And also the policy if you wanted to get in there.
Or maybe both. I mean, absolutely, it's a crucial and critical point, and it's one that we're very aware of in all of the work that we do. Because of limitations of time, I didn't go into great depth in terms of kind of how we set up the conversations in groups, but we do make it very clear that we're kind of focused on kind of imaginary individuals, made up individuals who are in reasonably good health, and we focus on that because we know that conversations about disability need addressing properly within groups, rather than kind of being tagged on to the end and being a kind of, and what would it be like if X, Y, and Z. We have done work within the centre looking at the additional costs that come with being deaf and partially sighted. We've updated some of those costs in the past couple of years for Thomas Pocklington Trust and then RNIB most recently, who use it as part of their submission on the adequacy of disability benefits recently, I think. So it's something that we're acutely aware of. We've also been having discussions with the Scottish Government in their thinking about minimum income guarantee and how they build in the additional cost of disability within that. So it's an area in which we're keen to do more work, but it's an area, as I'm sure you're all aware, in which it's kind of well, you could end up doing an enormous amount of work with different groups of people and arrive at very specific costs associated with very specific disabilities. So we have been talking about how we take a more general approach, and very happy to kind of have more conversations about that. And obviously it does bring additional costs. So all of those numbers that Juliet was talking about, all those figures that Juliet was talking about, will be made even more difficult by, as Tony was saying, the kind of the lower earnings of people with disabilities, and the extent to which the benefits that are meant to cover those additional costs don't actually go anywhere near, get anywhere near covering those additional costs, because those costs are so variable for people. So yeah, a really important issue, and one that we are definitely kind of keen to do more work on.
Devon, have you got something to add?
Yeah, I had just one couple of points to make on why the methodology is important. So in some other measures, so for example, the Social Metrics Commission measure, we take things like the amount of income people receive for their disability, like the DLA or PIP element, and we cancel that out on the cost side. So we assume all of that income is used for cost. It's obviously not as accurate as if we actually knew what their costs for disability were, but as Matt said, they're incredibly variable. The reason it's important to do something like that is if you don't, and you just take an income measure like relative poverty, then the additional income that you get for DLA, for the cost of dealing with for PIP, for dealing with the cost of your disability, are they push you above the poverty line. And you can actually see some of that if you look at the rapid dashboard. You can see some of that in just the way the poverty measures are defined. You see different levels of disabled people falling below those lines, and it's really more of a methodological trick. So that's why I think measures like MIS, which take some of those, well, or in particular the Social Metrics Commission measure, which cancels out the cost of disability, do a better job of representing that, as I think the comments and the questions have made. So that's probably the key point, is that there are costs. The best they're unique, and I think Scope did some work on this and a while ago. And when they estimated the costs, one, they're remarkably high, and would put quite a lot of pressure on. Kind of showed maybe that PIP in itself was inadequate for many, but they're also remarkably variable, which made it quite hard to, like, depending on your disability, that kind of went up and down quite a lot. So we can see why it's a very hard topic, but it's important that some of those costs are taken into account in poverty measures.
Yeah, Devon, here certainly in our UK Poverty Report, we also do some adjustments for disability benefits and obviously support the Social Metrics Commission measure as well.
Yeah.
Tony, do you want to add anything? No. Cool. So the question that's been voted up the most in the Q&A is about basically the experience mainly of kind of DWP systems and sort of claiming benefits and kind of the dehumanizing side of it. I wondered, Matt and Juliet, did that come through across in the, because obviously we've talked about other kind of public services, but certainly at JRF we would say the DWP and the social security system is a public service you want to rely on. Did you hear much about that in the focus groups? And then over to Devon and Tony about, yeah, almost like that kind of user experience of DWP, and anything you'd like to say about sort of how improvements there can take place. So start with Matt and Juliet again, if that's okay.
Yeah, the short answer is no, because that's not the focus of the conversation. So because we're asking people to focus on what they need rather than their experiences of interacting with the DWP or kind of local support services, it does come through in the kind of more qualitative work we've done. We're looking at households who are kind of living below MIS, so bringing up a family below MIS. The kind of the day-to-day interactions with the benefit system come out far more strongly in that kind of qualitative work, which is focused on people's experiences when they are living below that level, rather than the MIS work, which is very much focused on actually what is it that people need, rooted in people's experiences, yes, but not and how does that play into your interactions with the benefit system.
Thanks, Matt. And I suppose also it's like the kind of take-up side of things, where basically if you are not taking up those benefits because of the stigma or because of the processes, then you're going to be even further away from MIS. Tony, any thoughts from you in terms of some of your commission, or sort of in terms of like, yeah, how do we make this an easier, more navigable system?
Look, I really agree with the sentiment of the question, and it's sort of similar to your point, Peter, about kind of on your phone in. I mean, we do a lot of research with benefit claimants and with people on low incomes, people in and out of work, and it is kind of heartbreaking when you hear people's experiences. And I don't even say that's many people on this call. Now, I suppose there's a few things really. One is I think we've got particular problems around how the benefit system treats people with health conditions and impairments, and that just needs really fundamental reform. And we just need to be far more compassionate. We need to try to move off kind of the current sort of WCA part. This is about the WCA process. We need to try to move off that very sort of points-based arbitrary system that has a real lack of kind of natural justice and a real sort of lack of transparency in how decisions are made. And I think it's just incredibly dehumanizing. But also a lot of it is around what happens in job centres, because increasingly people are being required to undertake activities, being expected to attend meetings while they're waiting for a WCA, or indeed people who have sort of mild to moderate health conditions, haven't applied for a WCA, just want access to social security and help to find a job, and are pushed into kind of constantly justifying how they've spent the previous week, attending unnecessary meetings, explaining they've done 35 hours of job search. And unsurprisingly, one consequence is often people find themselves pushed further and further away from support, because we've created a hostile environment where people just want to get help for work. So the social security aspects, I think, are not an area I've done enough kind of work around how we could improve and reform that, beyond just, I suppose, adding to many voices that have said this really does need a kind of root and branch reform, a different approach. And the one thing I would say is it's really welcome that we've now got a Minister for Social Security, and I'm really pleased it's Stephen Timms as well. This is the first time in 25 years we've had a separate Minister for Social Security and a separate Minister for Employment. The Minister for Employment has been responsible for working age social security, and that in itself, I think, tells a story. Under Labour and the Conservatives, that's been the case. So I think it's welcome that these are different issues, and they should have different responsibilities, and I think take a different approach. And on the employment side, I suppose I'll just reiterate the point. I see kind of employment support, it's clearly really closely linked to social security, but I think in and of itself, employment support has value, it's important. Most people who access it do so voluntarily because they want help, and the fundamental driver of our employment system should be extending access to support for more people so they get the help they need through services that they can trust in ways that they would want to help them make progress towards work. And if they're in work, in low income in work, they're getting help to progress at work. that will require for some people where you're able to seek work and you know you're unemployed, as it were, requirements to attend meetings. Those exist across the whole world and have existed in the UK for 115 years. So I'm not saying we shouldn't have conditions, but the overriding purpose of our employment system should not be to catch people out and sanction them. It should be to support them. And I suppose that's what our commission will be arguing in the coming weeks.
Thanks, Tony. I agree with all that. And Devon, I know you've done lots of work with policy and practice to help people navigate the benefit system. But what do you think?
Yeah, I also agree with all those points. I think that there's two points to make. I think the first one's a story. I often talk to people who aren't as familiar with the social security system. We're doing a lot more work in, say, regulated sectors, so utilities and others, where they might be dealing with people who aren't as aware of the social security system, what the support it can offer. And I often ask them when we're doing presentations, you know, what do you know anyone who's had to claim benefits? You know, have you had to, or do you know anyone in your friends or family circle? Because I know the answer. It will be some you know, what was their experience like, and the answer is always some synonym of horrible or awful or something not very positive. Now, I think there is work going on to change that. There have been efforts to change that. I'm more optimistic about that changing now, perhaps, than I have been over the last kind of few years. And I think one area where I'm seeing real movement, as you say, sort of under Stephen Timms, where I know he's supportive, but also areas of things like the winter fuel payment, where I think they've created a problem of raising the awareness of non-take-up of benefits and what can we do about that. It's an area where, again, all these vaunted kind of improvements in data and technology and all of these things can really make a difference. So we're seeing that. We're doing a lot of that work ourselves at Policy and Practice, but we're seeing a lot more appetite for that work from government. And I think if you could reduce, for example, you know, people having to apply for, say, support from a dozen different places to having one or maybe one or two or three kind of singular core forms, I can see the government moving in that direction because it would deliver efficiency savings. So it's kind of a better outcome for citizens, some savings for the government, which will go out again in additional support. But that additional support is what makes the difference to people in those lives. And I think there's probably a greater recognition of the fact that actually, if you put the right investment in people early, that will pay off for the country over kind of not just the next year, but the decades to come. So probably overly optimistic. I've always been overly optimistic on social security, without a great deal of justification, but perhaps there's slightly more justification today.
Well, let's keep the pressure up, and yeah, hopefully that optimism gets justified by sort of putting pressure on. Matt and Julia, I've got a couple of kind of methodological questions, if that's okay for you. So one is about urban and rurality. What's, you know, whereabouts is this? What is like the centre of gravity of MERS? Where would you say is a representative of? And then changes on the food basket. What are the implications? Is it that we're eating more? Why is the food basket being rebased in the way that you've put into the system? So those are the two kind of factual questions that I'm interested in answers to.
So on the kind of rurality versus urban, MERS and the numbers that have been published this week are very much for urban areas within the UK. We did undertake some research in rural England, mostly, I think, although maybe there were groups in Wales as well, back in 2010, commissioned by the Commission for Rural Communities, which doesn't exist anymore. There was a lot of talk at that time about the kind of differences between rural and urban areas, and those differences to some extent have changed a little bit, but there continue to be kind of key differences in terms of costs, certainly in rural areas. And we've been interested for a few years in kind of revisiting that research to once again explore what the difference is between kind of rural and urban areas. But have yet to find someone to fund that. So if anyone knows of anyone, that would be great. I shouldn't use this forum to ask for money, should I? We do continue to do work in remote rural Scotland as part of the fuel poverty legislation there, and that does pick up on some really key differences between kind of remote mainland Scotland and islands in Scotland and the kind of rest of urban UK. The second point was on the food baskets. In general, as a population, we have got heavier and taller and less active. and the kind of reframing of the food basket, the slight increase, and it wasn't a significant increase in the kind of calories that that all the individuals within MIS require, is very much kind of rooted in those changes since we started. So in 2008, we weighed less, we were slightly shorter, and we were more active. In 2022, we're slightly larger, slightly taller, and less active. And it's important, I think, when we're kind of, because MIS should reflect the world kind of as it is, and rather than the world as we want it to be, that particularly when it comes to food, that food basket represents a kind of what looks reasonable to people. So it's not all, you know, incredibly healthy, or what would have been called green, brown food slash, you know. There are things in there that people would look at and you know, think, well, that's not terribly healthy. But what it is carefully constructed, reviewed by the nutritionists we work very closely with, and won't cause anyone any long-term physical harm.
Thanks. I think we've got time for one final question before closing remarks, making sure we finish in good time. And that's, I'm going to do like a two-parter about how does the winter fuel payment sort of factor into the kind of the minimum income standard basket, and what would a role for like a social tariff have in that? Would that factor into the minimum income standard in some sense, or how would it factor in? So I'll start with that, and then I'm going to go to Devon and Tony and sort of think about, and you may not be able to answer this, it might not be your area of expertise at all, but sort of, is there a role for social tariffs in tackling hardship or enabling people to meet the minimum income standards? So Matt and Juliet to start with.
As I noted at the end of what we were saying, I think doing things to address costs is really important, because this isn't just about boosting incomes, it's about addressing the costs that increase the you know, what people need to reach that minimum. And if there are ways in which social tariffs can do that, then great. I think certainly in our work on minimum digital needs, one of the things that's really clear with social tariffs for broadband is that they don't allow people to do the things they need to do. So if, yeah, social tariffs and different costing for different sorts of households or different income levels, you know, as an idea, I don't have a problem with it. But as ever, it's the way in which it is kind of rolled out, and it has to be, particularly with things like broadband, I think it has to, you know, be at a level that actually enables people to do the sorts of things that are described as being so key within MIS. Very briefly on the winter fuel allowance, we'll obviously take that into account from next year, because it was introduced post April 2024. So the current MIS figures don't take that into account.
Well, I suppose it's almost they do, but they won't be next time around, because is it or not? Like, it probably is included in the incomes for the pensioners at the moment.
That's what I meant. Sorry, we do take it. What I meant we didn't take into account the change. Sorry,
yes,
that should be clear.
Sorry, pedantic. That's one of my characteristics. Devon and Tony, any sort of thoughts on social tariffs and their possible role in moving forward?
I've got a few bits to say on take up. Tony, I don't want to sort of, hopefully not too much to say, but I guess the first point is to say it's a really good point. We've got a new piece of work coming out, which we'll be doing with Citizens Advice and IPPR on looking specifically at social tariffs across water, energy, broadband, and also potentially insurance as kind of areas of essential costs that are going up, and how do you protect people who kind of need access to those services. I think the key point there is, one, the massive postcode lottery, depending on kind of the level of support you get. Secondly, kind of very low levels of awareness. So if you look at our unclaimed benefits report, the lowest levels of take up are in social tariffs significantly. The regulators asked these industries to do more on that. They are doing more on that. They're just not doing it very well, right? They're trying, but just not with as much effectiveness. And I think the key things that you can do, or that we are seeing, is one, the ability to share data effectively across sectors and industries. So we're seeing water companies not just assessing people for social tariffs, but when they're doing that, assessing them for benefits at the same time. So we're working with a number of water companies to do that. I mentioned porting data, so accepting data from, say, a local authority that's doing a benefit assessment and saying, oh, we think you're eligible for a social tariff with Anglian Water. Click here. All the data is ported across to Anglian. You answer 2 additional questions. You don't need to fill out the form again. So reducing that admin thing. And then the final one is actually just putting people on. So we're kicking off a pilot before the end of this year, actually, to use data from Lift, so benefits administration data from local authorities, to say, these are the households eligible for a social tariff, matching those with the households in water debt, and the water companies agreed to just give them the social tariff. So again, this is reasons for optimism in this space. It can make a difference, lowering those costs, and there is a big drive to kind of support those people, because otherwise, what do you can sort of see that you're sort of taking blood from a stone for a lot of these households. So at the same time, getting the levels of take up from say 20% to 50-60% still isn't enough, I'd say. And the question is kind of where does kind of central government policy or regulation need to come in to make sure, mandate kind of the data available to these companies is used in these broader ways, or that you're not dealing with these kinds of postcode lotteries. And we'll be looking forward to kicking off that piece of work, even though I think some of the solutions feel somewhat obvious, having worked in the sector for a while.
Thanks, Devon. Tony, anything to add?
No, I'm glad I'm speaking after Devon and after Matt. Yeah, very much agree. And I won't keep us from our lunch. I think they clearly play an important role, and as ever in a lot of our areas of social policy, it's those issues around take up, awareness, and the extent to which they rely on the companies often rely on people's inertia and lack of awareness, frankly. And I think the work Devon's doing sounds particularly important in addressing that.
Sorry, Peter, there's one final point which I just kind of want to raise, is just the volatility of costs and the kind of their direction of travel. So we're in a cost of living crisis. There's some sense of, the energy costs had peaked. We found out that we were wrong about that. As we're kind of seeing over the course of this winter, we're going to see water bills rise without a shadow of a doubt. And car insurance costs have gone through the roof as well, for all of us, but having the greatest impact on those with the lowest incomes. So again, I probably want you to end, Peter, on a positive note after that. But sadly, I think these pressures aren't going to go away. And I noticed in the comments some points around kind of where I was saying the government's in a difficult position. I think it's in a difficult position because you kind of need to see that growth, or you need to see those overall costs come down. The need for investment across all of these areas is very substantial, and there are kind of these trade-offs being faced. I think they're doing things that are in the right direction, but fundamentally we're going to need to take some brave decisions and make these investments and probably stomach some of the costs that come with that.
Yeah, well, I think one of the things that we see in MIS is that those things will be feeding through, and we'll immediately see what the impacts are of rising costs. That's one of its powers, really. So I'm going to conclude and hopefully finish on time. So there is something called the resources tab at the bottom of your screen as attendees, which has lots and lots of useful documents. So whilst I'm kind of closing, feel free to click on them and get them open, or alternatively, we will send them around when we send around the pack, and you'll have a recording of this. It'll take a bit of time, not very much time, but a little bit of time, because we want to make sure it's subtitled, make sure it's accessible, etc., etc. But you will get a recording of this session. And I'd just like to really heartfelt thanks to Matt, Juliet, Devon and Tony Rosario for speaking, for the GRF events team for hosting this, and for all of you for attending. And thank you all. It's been a really good session, and enjoy your lunch, yes, as Devon says, and we'll be in touch. Thank you, everybody. And if panelists can go to the backstage room, that'd be brilliant. Okay, thanks everybody. Cheerio.
Thanks. Bye.